I am Vinnie Tortorich. Folks, your good intentions have been stolen, but don't worry. I'm here to help you get them back. You may be soft and succulent at the beginning of this process, but hang in there. Before long, you will be lean and mean, guaranteed. Yeah, haunting words. Ozzy Osbourne. If I close my eyes forever. And today is the 22nd when we were recording this, and Ozzy passed away. The great Ozzy Osbourne. We're going to bring our guest in real quick, and we're going to do just a quick little talk about Ozzy, and then we're going to move on because I got some exciting stuff today. We got Dr. Tro Kalayjian on, and we're going to be talking about everything. Food addiction, GLP-1s. Should you be on them? Should you not? He's got a new paper out there. He's got it all going on. So without any further ado, before we talk about Ozzy, let's bring on Dr. Tro Kalayjian. Yeah.
I'm happy to be back, Vinny. It's always a pleasure to talk with you, catch up with you. Love it. You know, you were one of the first people who had me on maybe 9 years ago, and did a podcast. So forever grateful. Super huge fan. You know that. I call you every once in a while and you pick up the phone. So I can't be such a terrible human, you know?
Yeah. Tro, you're one of the good ones. It's funny. Sometimes a neighbor came up to me the other day and, guy, he knows what I do. He's never heard my podcast or whatever. But he's in his mid to late 70s. I guess they don't listen to podcasts. And all of a sudden he calls me. He goes, "Hey, you ever hear of Eric Westman?" Like, yeah. Why? He goes, yeah, he talks about not eating carbohydrates. You think that's a good idea? And I said, his name is Rodney. I said, Rodney, that's exactly what I've been telling you. Yeah, but I'm reading Eric's book. It's like, okay, you didn't want to listen to me, right? But now you're ready. And by the way, in no time, 77-year-old man lost 20 pounds, right? Have I ever heard of Eric Westman? I was like, yeah, he was in my first 2 documentaries, and he was on my show as early as 2012, maybe, 13 years ago. Same with you. The other one I get, Tro. The other one I get. You ever hear of this guy, Dr. Sean Baker? Yes, I was the first podcast he had ever done. I had the guy to my house. I don't know who he was. He came on. He was talking about just eating meat. And I get the same thing with you. Hey, I'm reading about this guy, Tro Kalayjian. Except they never get Kalayjian right? They screw it up. As soon as I hear Tro, I go, hey, don't even say the last name.
Listen, I'm going to tell you, Eric, I just got to give a big shout out to Eric Westman because, he wrote the textbook that I read when I was in my training. It was his study with Yancey in 2004 that opened my eyes. He was one of the first guys who really said, let's put this into the medical literature the right way. And I am forever grateful to him. I've worked with him at the SMHP, for the last 5 years, the Society of Metabolic Health Practitioners, and I'm forever grateful to him. We've worked on a couple of papers together, and he's been, he's been one of those people who's really guided me. And Sean, what can I say about him? He's just a beast. Look at him. He's a world record holder. It's just massive. He's like a 250-pound guy, just all, and he's doing great things to spread the word that, hey, you could eat pretty much just meat and thrive. So love both of those guys. I wouldn't even consider myself on the same level as them, man. They're great.
You are, because you're out there. You look, you did something that a lot of people haven't done. And I send people your way all the time. So when people call me for a consult, if they have medical issues of any sort, or if they're a low mass hyperresponder, lean mass hyperresponder, or they have this or the other thing, I'll say to them, go to this guy. His last name is spelled Kalaygian,
Close. Yeah.
That's not it? We're on this.
That's why I shortened it, man. It's Dr. Tro. T-R-O. There you go.
Yeah, but I send them straight to you. And I always say to them, Tro, mention my name. It won't give you a discount, but they may move you up a bit, right? Because I know you guys are busy over there.
Yeah, we've grown. I mean, Vinnie, when I was on your podcast in 2017, I started taking my first telemedicine patients, and that was, it was in my infancy. I was like, I'm going to leave Yale. I'm going to do good medicine. I'm going to do what, Nina, yourself, Eric have been talking about for at least 10 years at that time. And that was then. Now we have 15 employees, 4 health coaches, 2 docs, a PA, and every single person on my team, and it's amazing, has been touched by metabolic health. I mean, Amy, who she lost 220 pounds. Brian Wiley lost 100 pounds. Vic Basmajian lost 100 pounds, came off 5 meds. Tia Reed, one of our health coaches, food addiction, certified coach. She lost 80 pounds, came off 20 meds. Myself, I mean, my story, 150 pounds down. Dr. Laura's life's changed with metabolic health. And we're out there in the trenches, and we're just trying to help people get healthy and do medicine the way it should be.
You mentioned when you were talking about the amount of weight, I know of Amy Eichen and Wiley. I know those guys. And I know their stories very well because I've had, I think, both of them on this podcast at one time.
You've had all of them, yeah.
Yeah. And okay, the weight loss is one thing. But you mentioned this person with 5 medications. I heard the word 20 in there.
20 medications, yeah, Tia Reed.
And by the way, folks, that's not an exaggeration. I can't tell you the number of people that are on at least 10 medications. These are daily medications, at least. And I talk to these people day in and day out during the consults. And, they'll call me and say, hey, I was on 15 medications. I'm down to 7. And my doctor says if I do this, that, and the other thing, I could be down to, and these are people who have been taking these drugs, these chemicals, just loading their livers up, their bodies with these chemicals year in and year out. So I've told the story several times. I was about 50 years old, 51. I happened to be home in Donaldsonville and ran into a bunch of classmates. They were having a little get together, and they said, hey, why don't you show up? I saw people I hadn't seen since I graduated high school. And here we are, 50 years old. And the first guy that pulled me aside, he goes, hey, Ben, you look like you're in pretty good shape. I said, oh, thanks, man. He goes, how many medications are you on? I'd never heard that before. Right? I was like, what are you talking about? I thought he was asking me if I was doing steroids or something. And he goes, how many?
LCHF, TRT. Yeah. Give me some TRT.
I've never taken any of that stuff either. I think it's a compliment when people go, are you in hormone replacement therapy? No, I'm on life. I was saying, no, I don't take any drugs. And he goes, so you're not prescribed anything? And I was like, no. And that guy said to another guy, goes, hey, come here, you got to hear this. Vinnie, tell them how many drugs you're on. I said, what are you guys talking about? Why do you think I'm a druggie? I didn't know this even existed back then. And everyone at that party, everyone I talked to said, oh yeah, I take this for sleep. I take that for that. I got the CPAP machine. I got the thing. I got that, beep, boop. 10 medications was the average. What's the average is higher than that now, right, Tro?
Oh, it's more than 1/3 of America is on a prescription drug, and more than multiple. The average adult over the age of 50 is on 4 medications. The average adult over the age of 50, 10, probably 15% now. 15% of the nation has been on a GLP-1 drug. Just think about that. 80%, 90% actually took, the COVID vaccine, just to give people an idea. This country is about medications, right? Hopefully we don't get canceled for that. But, SSRIs, right? Yeah. SSRIs are widely prescribed. I mean, it is this is the problem with medicine, and most people don't understand it. There's times like when you need heart surgery, where medicine is beautiful. There's times where you have cancer, you need an excision, radiation, and you need a treatment plan. And this is where medicine shines. But when it comes to chronic disease, right, diabetes, hypertension, obesity, depression, anxiety, right, these are the basics. Honestly, like I think a priest, I think a priest or a good mental health counselor can do better than most doctors, right? I mean, like what happens at the doctor's office? You go in, you sit for 2 hours in a clinic that you didn't want to sit in a chair you probably don't even design comfortable, you don't even fit in. And then, you fill out some forms, you pay a copay, and then what happens? Doctor sees you, scribbles on a little pad or whatever, doesn't even, types in a keyboard, pop, 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 pop. And, 5 minutes later, you have a script for Ozempic and an SSRI.
All right, let's calm down, Tro. This is not the Megyn Kelly show. You've gone from, everybody's on the shot, and all you need is a priest. I'm with you that if more people got out and got some fresh air.
Yeah, a personal trainer, a health coach, a priest, a mental health counselor, any one of those, man.
Studies that show that just being out in nature changes your whole outlook on everything. So I want to go back a little bit because there's a lot there to unpack. The average adult over 50, you said, is on 4 medications. Your guess is, what are the 4 most common that we're seeing for over 50?
Blood pressure, SSRIs, right? Cholesterol-lowering medications, diabetes medications, right? So, and then we'll add a 5th, which is reflux medications.
Okay, so SSRIs, look, some people need them. I'm not going to sit here and go, because I will get phone calls. You don't understand. I would have killed my wife if I didn't take those things or whatever. I get it. Some people.
Look, I can say all the bad stuff. Okay, I can say. Let me say some of the controversial stuff.
Okay.
Exercise is more effective than an SSRI for depression or for anxiety. If you have mild to moderate depression, a placebo is nearly as effective as an SSRI. If you have severe depression or if you have severe anxiety and you're working closely with a mental health counselor and your team thinks that in addition an SSRI is appropriate, maybe that's a use case. But, if you walk into an office and you're just tearful because somebody passed away, I mean, they hand it out like candy.
Really?
Right? They hand it out like candy. I can't tell you.
You're not saying, hey, SSRIs need to go away. You're saying, folks, I want you to hear what Tro is saying. You're saying there's a time and a place for them, but not when your puppy gets run over by the dump truck, right?
Look, I'm not the one to judge, right? But by the book, right? 2 to 4 weeks of grieving is normal, right? When the puppy gets run off the truck. But now in modern medicine, if you come into an office tearful, what do? Here's Prozac, here's Lexapro, right? So the problem. The medications have issues. The problem, I think, is the doctors, right? Why are we handing it out so easily? And if we do use it, why aren't we looking to taper it off quickly, right? And this is what our clinic does. And, I talked about this before. We are a deprescription clinic. You come to us to say, hey, what are those drugs that I can come off safely? How are we going to do it safely? And what are the ones that I really actually need?
Right.
It's not the drugs. It's not the drugs' fault. I mean, I really blame my profession. I don't mean to, be so critical. But, when more than 12 or 15% of the country's been on Ozempic or Mounjaro, right? How many have been educated on a diet, Vinnie, you think? Not that much.
I'm going to go with 0 because I talk to these people daily and I have family members on these drugs. So let's go right into those, right? When GLP-1s got popular for weight loss, you and I have known about them for years because they use them to try to artificially lower your A1Cs, for a long time, right?
Yeah. Over a decade. Correct. Yes.
And when I say artificially lower, you're not really, again, if you're not teaching. So for anyone who is new to this, so explain what A1Cs are and where the normal number should be. And then let's talk about that for a minute to talk about how we can lower it naturally and what the GLP-1s were doing at the time.
Yeah, so super easy, okay? Sugar in your blood chemically binds proteins. It binds to your arteries, damages them. It binds to, the eyes, the kidneys, the nerves. There's just the problems in diabetes when the blood sugar is high. And it also blinds your hemoglobin. It chemically attaches to the hemoglobin. And a hemoglobin, A1C or short A1C for short, right, is literally measuring the percent of hemoglobin that has been bound to sugar, right? It's a hemoglobin A1C. And when that number is in the high 5% range, 5.7 or above, that's prediabetes. Okay, quote unquote prediabetes. That's what they call it. 6.4 and above is considered diabetes, right? So, and the average drug like metformin or the Ozempic, or before that, it was Victoza and Saxenda and Trulicity. All of these drugs lower that A1C by about 1% by doing a couple of things: making the pancreas work much more efficiently, so it squeezes a ton of insulin out in less time, and it brings that A1C down. But it also works in other ways, but slowing the gut a little bit down. But that's also how it causes problems, right? Pancreatitis is a complication of these medications. The vision changes, right? Blindness is a complication because it lowers the blood sugar quickly. And gut issues like diarrhea, constipation, less than about 50% of people that start these drugs stay on them over a year. Most people can't tolerate them. And the sad part about these drugs, and again, I don't blame the patients, because and I know, we've seen people, they know nothing about nutrition, they were taught a bunch of lies, and they're seeking help, and their doctors give them the solution. But, 9 months in, when they can't take it anymore because of the nausea or the vomiting or the diarrhea or the stomach pain, right, what happens is, this is the worst part. The drug takes away your muscle mass. About 30% or 35% of the weight you lose is your muscle. So when you come off the drug, right, which 50% of people do, you gain weight twice as fast as if you just stopped your diet and stopped exercising.
Why twice as fast, Tro?
Most likely two things. One, you're losing a lot more muscle, so your metabolism is shifted down. Two, these work on your reward centers of your brain, and then when you take that away, you're all of a sudden really crave really amazing food. And then three, because you didn't learn probably some of it, and this is not in every case, but you needed to learn some skills on how to manage your eating, and you kick that can, with your doctor's help down the block a little bit, down the street a little bit, and you didn't address it up front. So it's a setup to fail for many people. And so this is a huge, huge issue, and we're already seeing it. Vinny, we have a clinic full of people who are calling me every day saying, I did Mounjaro, I did, the lap band together, and it's not working. I did the Ozempic, it's not working anymore. 1 month in, they're like, my cravings are back. And I don't know what to tell you, because my heart breaks, Vinny. I don't know what to say. It's like, it's just, I would never want this for people that I care about.
I've always said that when people lose weight naturally, when they use a guy like me to lose weight, let's say you lose 100 pounds, I always tell them, we need to get you to the gym. And they'll go, why? And I'll go, because They'll say, you say exercise is a poor way to lose weight. It's like, yeah, exercise is the worst way in the world to lose weight. But if you lose 100 pounds, 20 of those pounds will be in muscle mass. And that's the best case scenario. When you're losing weight naturally, you're going to lose some muscle with it.
It's actually less. Yeah, it's probably that. If they go with you, they're probably going to lose 10% muscle.
Yeah, I always say 20 because I want people to get in the gym, and it could be as much as 20. It's probably more like 12 to 15. I would agree with you on that. Now, you said 30% when you're taking a GLP-1.
40% in some cases, yeah.
Ben Bikman, in my last documentary, Ben Bikman stated, and I went back to him before I put that in the movie. I said, Ben, you said 50%. He goes, I stand by it. We've seen it in clinical trials. Because he's done more with this than almost anyone. He goes, it can be as high as 50% muscle loss. Think about that. You're taking an aging person, once you hit 40 years old, sarcopenia is coming after you, right? That's why a guy like me works out as if I'm going to go play football again. And by the way, I'm not getting big. I'm staying about the same, which is all you can hope for. If you're doing that and you're aging at the same time and you have sarcopenia, good luck. Good luck. And by the way, your heart is a muscle. Your heart is a muscle. There was a woman, she was a great drummer, had an angelic voice. Her name was Karen Carpenter. You might be too young to remember Karen Carpenter. Yeah. And she died of anorexia. They finally got her to start eating in the clinic and the whole thing, but her heart was too weak. She was a very young girl. I don't think she was even 30 years old. She died from heart failure. That's what happens when you lose too much muscle. Tro, agree, disagree? Where am I on that?
100%. And this is something that animal models have shown that exactly what you're saying with the GLP-1 medications, that they decrease the cardiac muscle. It's yet to be seen. And here's the problem, right? The problem is if you take somebody with, severe obesity, class 3 obesity, and you take somebody with diabetes and you get them to lose weight, we know a lot of good stuff happens. So these drugs look good, right? Because they make people lose weight.
Yeah.
That doesn't mean they don't have risks. And I'll give you the cleanest example. Okay. This drug in animals causes thyroid cancer. Okay. It has a black box warning for medullary thyroid cancer. It stimulates the GLP-1, the C cells of the body, which are in the thyroid gland and some other areas. They are stimulated by by the GLP-1 hormone, and they have a lot of these receptors. Now, what is that for? Right? To build bones, right? To prevent bone weakening, right? So when we look at the data in humans to see, hey, do these medications cause thyroid cancer? They don't. So everybody's like, oh, this is safe. But if you look at all the other cancers that are affected by blood glucose levels and obesity, like colorectal cancer and like breast cancer, for example, the rates appear to be improved. Well, that makes sense, right? If you're treating high blood sugar and you're getting somebody to lose weight, they're going to have less cancer, right? That makes sense that these drugs will do that. But thyroid cancer doesn't go down. So what it means is it's causing thyroid cancer and simultaneously helping thyroid cancer. Well, what happens when you stop losing weight? What happens when you're on this drug for 2 or 3 or 4 years? You're now out of that window of benefit, right? And you're more likely to be harmed. And this isn't a knock against the drugs. The drugs have a place. I have patients with really severe diabetes. We were able to get them off insulin, and they're using some of these drugs, or people who are in a really bad spot, unable to try lifestyle despite coaching, food addiction help. We use them, but it's very rarely, and we try to get people off. But if you think about the regulatory process, which is do a trial for 1 year, do a trial for 2 years, right? It front loads all the benefit. And we're left to figure out the side effects years later. So this is the issue, right? We're facing with these drugs is that docs are inappropriately just leaving them on. We saw the same thing happen with proton pump inhibitors, antacid medications. Docs would just hand out Nexium and Prilosec like it was candy. And what happened? 5 years later, they started getting fractures. Their magnesium and calcium levels were so low, right? They started getting C. diff, right? And we're like, oh, where did this come from? This person had no risk factors. Well, you put them on that PPI for 5 years and they didn't need it for a little bit of reflux instead of talking to them about diet. You know, and we're seeing some of those same issues with long-term use of SSRIs. Right? People who've been on these SSRIs, like certainly if you have severe depression, severe anxiety, right? There's a place for these medications. Talk to your psychiatrist. Don't listen to me. Don't talk to your doctor, right?
Listen, folks, you know, I have friends who, if they weren't on them, they would be dead. They would have killed themselves. Bottom line. You know, there is a place for SSRIs, but like I said, your puppy gets hit by a school bus. That's not the, you know, just because you're upset, there's no reason to be on it.
I think here's the problem, right? Now we're noticing all the long-term effects. You know, these young men and women who are 45 years old, have been on these SSRIs for 20 years. They're like, why is my sex life so terrible? I can't get aroused.
Right.
Right? And these drugs are implicated. So the thing is if you need it, only you would know, but you got to have that medical team that's there with you, challenging you, saying, hey, which one of these can we take off? Which one of these do you not need anymore? Because they're not benign. And that's been my mission, you know, Vinny, it's just to do good medicine, you know, and it's not easy. You know, it's not easy to do.
No, it's not. We're going to take a quick break, and I have a question. This might be coming out of left field. I'll give you a hint as to what I want to talk about. You mentioned because it's so popular now, these doctors are handing out the testosterone. And I'll tell you a few stories of, you know, so I want to go into that. But first, I have to tell everyone about PureVitaminClub.com. Folks, I took my company back. I had someone else running it. I took it back and I said I would make it great again. Make vitamins great again, MAVA. Just came up with that. Maybe it's not so good. Okay. I turned the company around and everything ships on time. Everything is always in stock. And here's the beauty. It's the same great ingredients we had before. We only use top ingredients. I'll never forget about 3 or 4 years ago. Tro called me out of the blue. He goes, hey, you're multivitamin. Do you guys use methyl B, methylfolate? I was, absolutely. He goes, okay, I just wanted to make sure. Because we don't mess around, folks. It's the best form of every vitamin in each thing we sell at PureVitaminClub.com. These vitamins have no excipients, no flow agent. You're getting exactly the vitamin and nothing else. So go check out PureVitaminClub.com. Go there now. You're going to take vitamins, you might as well take PureVitaminClub.com vitamins because they're the best on the market. We're talking to Dr. Tro Kalayjian. Tro.
Wait, I got to tell you, I love the fact that there's no titanium dioxide. And so, you know, I'm tired of getting these pills and you see cornstarch.
Yeah.
And sometimes they don't even list it.
Psyllium.
Right?
That's phenomenal.
Yeah. Oh, my God. You know,
like silica. You know, psyllium and silica.
Oh, the silica. Yeah, silica dioxide, titanium dioxide. Like, why do I need this stuff in my gut? Like, I don't need this stuff.
Do you know why they put titanium dioxide in vitamins?
It's to make it powdery, right? Isn't it to make it powdery?
No. You know, they put it in there to whitewash it, so then they can turn it into another color that you think a vitamin should look like. It's a whitewash. Yeah. And by the way, it's been shown even in nanoparticles that titanium dioxide can cause colon cancer. And almost every single vitamin you buy has titanium dioxide in it. except, and we just turned this into a super long ad for my company, but
That's
yeah.
okay.
Yeah.
I'm a supporter.
So Tro, look, people, I do, just like you, I do phone calls all day. I do consults, and probably a couple of 3 times a week, if it's a dude and he's in his 40s, 50s, they'll ask me about HRT or TRT. It's called 2 different things. My answer is always, first they'll ask if I'm on it. And the answer is no. I've never taken any sort of hormone in my life, ever. I've never taken, even when I played college football, all of it, I've always been straight. And I plan on dying that way, right? And by the way, am I completely against it? No, because, I have cancer and all that. I have reasons to never touch the stuff, right? We don't even know what it does down the road. But guys are taking the stuff and then they're having complications. I want to hear what you know about them and if you think they're safe to take and where you are.
Yeah. So I've gone back and forth on this, and I'll leave you with all the assumptions I had, and I'll leave you with where I'm at. I'll first start with, the theme of atrocious medicine. There's a clinic down the block from me. I forget what it's called. They are literally hiring NPs and PAs and giving even 20-year-old kids testosterone. If their level is 700, they make it 1200. If their level is 500, they make it 1200. And they're giving out injections and creams and like it's candy. Right. So there's literally a franchise with over 500 locations that does this. And I think it's a crime.
Right.
So I'll start with that. 2 is, look, if you look at obesity, metabolic syndrome, low carb, high fat diets, what do? They improve testosterone function. If you do all that, you lose weight, your health is improved, and your testosterone's still low, and you take Vinnie's magnesium, and you take Vinnie's zinc, and you take, and that doesn't work, and you go on, a high quality boron, 3 or 6 milligrams twice a day. Right, you do that for a month, and it's still low.
What was that? Did you say boron?
Zinc, magnesium, boron. Yeah.
Okay.
Let's say you do those, and it's still low. And those are temporary measures. Now, you're like, okay, what should I do? Right? What should I do? And for most people, it's like, just go work out, be your healthiest self. If you're not, like, the people I say that you should consider TRT for is if you've done everything, okay? You've truly done everything. You're eating real food. You're replenishing your body. You tried supplements. You tried exercise. You tried, a bit of sauna. You tried red light. And you're not there. And it's affecting your quality of life. And I mean, the bedroom, really? Men? Then maybe consider it, right? And if you're going to consider it, just realize you're setting yourself up to need it for the rest of your life.
Okay, so let's use me as an example. Ever since my first round of chemo back in 2007, every time they do my blood test, and if they check for testosterone, it's been as low as 200, 225. A high number, if I go get the blood test done in the early morning, we've seen 400, something like that. I have no trouble sexual, I don't want to get gross, I'm an old man, no sexual function problem whatsoever. I can still put muscle on at the gym.
So why would you take it? Why would you take it?
Well, my question to my doctor is always, if they're saying you need at least 700, 800, 1200, how am I having sex and putting muscle on with, that of an 80-year-old man's testosterone? And her answer has always been free testosterone. I was like, okay, well, explain that to me. She always says, your body you don't have a lot of testosterone hanging around, but your body figured out how to use testosterone very effectively. And maybe it's because you've always been in shape and you're very lean. a lot of lean muscle mass.
Correct.
What's for you, bro?
Yeah, so fat has aromatase, which converts the testosterone. So she's 100% correct. And, the SHBG in your blood, and this is what boron does, there's ways that you can make testosterone inactive. So look, a 400 level is a respectable level. I don't know if you're in your fifth decade, sixth decade.
I'm 63 coming up.
Yeah, so I think you can certainly live with that. Now, if you came to me and said it's affecting my, so you wouldn't be the first candidate. This is straight up advice. I wouldn't put you on it.
Right. I would never go on it. I feel let me get gross here for a second, but I want to have more sex than my wife wants to have. Why should I want any more than I already? You know what I'm saying? I don't need any more testosterone.
I will tell you, well, who might be somebody you consider it in, but again, 90% of people need to put in some of the basics in before they just go to a drug, because once you go to testosterone, remember, you're feedbacking, right? Like you're creating a stimulus for your body to stop creating on its own. It shrinks it, that you're making yourself need it. So once you cross that line, in my opinion, you got to be ready to take this for the rest of your life. So it's got to be that severe. And if it's not that severe, you have to be honest that you want to self-experiment, right? And I'm usually not interested in that. In rare cases would I be interested in that. Now, so I think, but I'll tell you here the myths that we've dispelled. Some of the side effects, for sure, it increases the prostate size. Okay, and it's linked with prostate cancer. So if you got a family history of prostate cancer, probably not the thing you want to be doing, or if you have a big prostate. The other thing that used to be a thing is, and maybe still is a thing, it's been linked with heart disease, right? But when they did a 5-year study and they brought people from that 2 to 300 range to the 5 to 600 range with transdermal testosterone, it did not increase the risk of heart attacks in people with known heart disease. So to some degree, meaning going up to that 600, if you need it, and if your quality of life is crap, and your doc is just reflexively saying, I'm not going to give it to you because of heart disease, right? Well, they've shown in long-term studies it doesn't increase that risk. So that's some of the nuance. I used to be the doc that said, I'm not going to give it to you because of heart disease. They've pretty much 2 years ago or a year and a half ago, they disproved that. It doesn't, if you do it responsibly, it does not increase the risk of heart disease. If you go to 1,200 or 1,300, you're going to have a heart attack.
But you did say before that, you had me at prostate cancer, right? I mean, if it can increase any chance of prostate cancer, that's reason number one to never touch it, right? I mean, why even get to heart disease?
Well, so it's a good question, and I leave that to the person in front of me. If they're like, Tro, my sexual function is down, and we see that in people who needed testicular surgery or people who have a pituitary issue that knocks that line out. I mean, they go from having a great sex life and a great drive and a great, and to then having a little depression, no drive whatsoever, no sexual performance whatsoever. So I think there's a person out there where there's a responsible use. I mean, it's certainly not the abuse that we see, most of the time, which is these super therapeutic levels. And, even with women, I got to be honest with you, I'm more concerned about the women on testosterone than the men. I can't tell you how many, women come to my office who've been given a pellet by a doc and their testosterone level, and I kid you not, is 400. Vinnie, I have, that's your level of testosterone, and they get tracheal enlargement, they get clitoral enlargement, excuse me for the, X-rated material, but they get a deepened voice, they get an Adam's apple, right? And my heart goes out because yes, postmenopausal women have symptoms, and yes, low dose testosterone has been shown to, like, I mean, really low dose, like 1/10 of male dose. That's been shown to give them their drive back, right? But there's this whole wild west of hormone replacement that's happening right now in the med spas and the online programs. And I don't know what to tell you. I'm seeing women coming in looking like men, and it's irreversible. That's the worst part. If you're a woman out there and you're going to get a pellet for hormone therapy, if they put too much testosterone in there, the changes are irreversible.
Yeah, I knew a lot of bodybuilding women back in the day, and they would all complain about the clit problem, and to the point where, I mean, these are women that's on really high doses for a long time, and they would have to. It sounds awful. They would have to get it lanced. Yeah. Just can you imagine?
Oh man.
I mean, I cringe a little bit, like my butt tightens up when I even hear that.
Yeah.
So it makes you wonder if it's going to change your body that way on something, a part of your body that you can see. What else is it doing? And that's always my thing.
Yeah. Look. I think again, you need responsible docs. Like I work with Laura Buchanan, Dr. Laura Buchanan. She's been on the show a couple times. She's first of all, I'll readily admit this. I got the 90th percentile on my board exam. She comes in, she's 99. I mean, she's valedictorian of her class. She's 99th percentile. I mean, she's a star. She got her NAM certification in hormone replacement. Like I have met, I would send my wife to her. Like my wife was like, hey, maybe I'm perimenopausal. I sent Ro. I was like, Ro, go talk to Laura. Because I know she's not going to push drugs. She'll have an honest discussion, and she'll be real about the side effects, known and unknown.
Right.
And I think that's what most people are looking for. They just don't want a doctor that's going to say, don't do hormones. Or, yeah, absolutely. Here you go. Here's a pellet with 400 mics of testosterone in it,
Yeah.
I think people are looking for just a bit of discussion, and they want to know, and they want a team that can, like, actually gives a crap. Vinnie, we have scales, blood pressure cuffs, CGMs. We got an app that is linking things up in real time. I'm tracking, Apple Watches to see the steps in, and our coaches, every single patient in my practice has a coach, right? And they are like, we are a family. We want to take these people. We don't want to let go, right? We want to make sure that we are doing their best. Because people come to you, like, how many years have they been struggling? How many diet plans have they failed?
Every one of them. That's why they're here. If one of them had worked, I wouldn't be hearing from them. So you had mentioned boron. I've heard boron, everything from joint health to bones and everything else, and also a hormone. They say it levels off. I don't even know what that means. But the other one people ask me about is is going to come. DHEA. Is that right? Yeah, DHEA. Where are we with that? I know it's a pro-hormone. There's been books written about it. Some people say take it, it's great. Other people don't touch it. What is it? Should we be looking at it?
I'm gonna be honest. Like I said, Laura is the resident hormone specialist. So I would say, let's get her on. And she could tell you all about. I deal with food addiction. I deal with diabetes. She's managing the hormones. She's just smarter and better. But bottom line, DHEA converts both to testosterone and estrogen. In terms of the supplementation and the doses, I know one of the issues with it is that you can't really predict because it's converted both ways. So you can't really predict which way it's going to go. It's probably better suited in women than men. But this is Laura's area of expertise. She's the hormone queen. I'm the food addiction and the diabetes.
I'm going to get her back on. Every time I get her on, she's got that stupid Dr. Pelkin sitting next to her. I'm going to have to get him off. And
no, he's great. Matt's great.
I love Matt. Every time they come on, they're on together. And they have a baby now, so one of them is usually
Hold of the baby.
While I was trying to talk. It might be time for me to get Laura back on and ask her about hormones, because I get these questions every day. I say, guys, I'm not a doctor. I'll bring it up on a podcast if I can get a doctor to talk about these things. But, other than, Suzanne Summers telling everyone you got to take DHEA, and I'm not sure if you should be taking advice from an actress who's now dead. But, that's, we've been hearing about it since the late 80s. And here we are in 2025, and you ask doctors, and they keep going, I don't know.
Look, I'm going to tell you, for, I'm more men's health oriented, right? And Laura will take care of both. For most men, if their testosterone's low, my go-to supplements would be zinc, magnesium, and sometimes, most of the time, selenium. We're checking these things. And boron is like that positive ionophore. It certainly works for bone health in one way, but it also makes more free testosterone. So if somebody wanted a benign sort of way to approach it, that's an approach. I think it's good enough evidence to try it, very low risk, right? Try to go for a pure vitamin club, where you can, and then maybe a well-rated consumer, check consumer lab, the other supplements, but. Women's
asking this, Joe. Boron is an element, right? It's just a natural element on the elemental chart. What is there a special kind of boron? Is there a breakdown, a molecular structure breakdown? What do we know about boron, and what should people be looking for when they take it?
Yeah, so we're getting a little outside of my scope. I got to go back and become much more familiar with it. Go back to literature and sort of refresh my memory on. Boron. It is an element. What is it usually paired with? Honestly, I got to go back and look. I did this research once before. I used consumer labs to get high quality supplements. I got to bring it up, Vinny. So I got to punt on that one and say I don't know right now.
I love when people tell the truth. I hate when people try to mail it in. That's what I love about having you on the show. I want to talk about these papers you've done, but I got to take a quick break here. So I know you're always working on the paper. You're always doing something. I want to talk a little bit about that. You got time to stick with me, Tro?
Yeah, let's do it.
All right. Folks, Vinnie Tortorich. I'm going to tell you guys what I did about 2 hours ago, maybe 3 hours ago. I came from the gym, worked out really hard. It was push day. I don't know if you guys can tell, but my chest is extra pumped right now. Got home from the gym. And I had something sitting in the fridge. Now, let me tell you what I did. Yesterday I took a tomato and I chopped it up. I put it in the bowl. I chopped up some white onion. I put it in the bowl. I threw a little salt on it, and then I doused it with Villa Capelli. I put saran wrap over the bowl, threw it in the fridge. I let it sit overnight. You see, that way all of the stuff, the olive oil, the tomato, the olive, I don't know what happens, but some kind of Italian magic happens. I came home from my workout. I pulled that bowl out. I threw a little feta cheese on top, and I'm still thinking about how delicious that was. Villa Capelli, folks. Villa Capelli, the best olive oil on the planet. I'm not just telling you that because they pay me, which they do. I'm telling you that because you can't really trust olive oil. I know it's a shame. Think about it. You go buy any of the crap off the shelf, right? It's going to have a colorant because they add so much seed oil to it. They have to have color back, and then they have to put an odor in it to make it at least smell like olive oil. Not at Villa Capelli. You're going to get all of those polyphenols, all of those things that are very healthy for you. Villa Capelli, you want to save 10%, put in promo code Vinnie, VINNIE. Promo code Vinnie, you'll save 10% every single time. Villa Capelli, we use it here. You want to use it wherever you are. Let them know we sent you. Promo code Vinnie, VINNIE. We're talking to Dr. Tro Kalayjian. And Tro, you have been working on another paper. What's the paper about? Tell me all about it.
Yeah, so this is building. So, Vinny, I started 2017 direct to consumer, sort of concierge telemedicine. And over the last 5 years, we've really switched to corporate. So if you're a corporate HR person right now, if you're in the C-suite and you're like, gosh, I want to bring metabolic health to my company, I want to get my employees healthy, we've published on this now. And we published on it 3 years ago. We showed that the average weight loss was 38 pounds at a year, that people came off of $4,000 worth of medications, that their AHA heart risk dropped by 44%. We published another study this year showing another company, in less sick people, basically the same results, pre-diabetes, they came in average age of about 56, their A1C was about 6, right? They had high blood pressure. We dropped their blood pressure in 1 year's time by 17 points.
Wow.
Okay. They dropped their A1C by 1 point, which is pretty big. It's like Ozempic, while we stopped their Ozempic.
Wow.
Right? And they lost 43 pounds on average. So, and this is a 1 year study, and a cohort of those patients, we stopped Ozempic, and it didn't matter whether they were on Ozempic or not, they lost weight. Which means that whether you're on Ozempic, off Ozempic, you can still lose weight with lifestyle and good coaching and good medicine. And that was a little bit healthier group, and we saved that company just in medications alone, $2,000 per employee per year. So that we published that in February. Okay. Now we said, well, how did that affect their food addiction and binge eating? Right? How did that affect their depression and anxiety? So we went back and we looked at the companies where we helped these people getting a high touch point medical service. I mean, app, medical equipment, remote tracking, health coaches, group meetings. I mean, you know what we do, Vinnie.
Sure.
And we dropped their binge eating by 80%.
Wow.
Right? And we dropped their food addiction symptoms by 50%. And you have to understand, just for the listener out there who may not know what these are, binge eating is like you eat until it hurts. You lose control and you eat till it hurts. Food addiction is like you just had an amputation for your foot and you're still having that Butterfinger bar.
Yeah.
Right? You just can't control it. You want to stop it, you can't. Right? And the stakes are high. So what we saw was this, quote unquote restrictive diet, which you've heard the dietitians say for decades, intermittent fasting, low carb eating. It actually improved an eating disorder, improved binge eating symptoms and food addiction symptoms. And this was in 50 patients, but it flies in the face of everything the dietitians have said. So you know me, back 7 years ago, I published A1Cs of 12 going to 6, and I had to put it out there because they said it's weight loss. We showed them these patients, they really didn't lose that much weight. The National Lipid Association says if you have high triglycerides, you can't have a low carb diet. So we showed people with 1,000 triglyceride coming down to 100, and we published that, and we said, screw you to the NLA, the National Lipid Association. So now we're letting the APA know, the American Psychological Association, that actually a ketogenic diet helps with eating disorders, because they say if you have somebody with an eating disorder, don't do fasting or don't do a ketogenic diet. So we're trying to rock the boat. We're trying to get the truth into the literature, and we're trying to help companies save money and get their employees healthy in the meantime. And let me tell you one last thing, and I know I've been yapping for a long time. The average employee that started with us, and they get this for free, Vinnie. The company pays for it. They get it for free. The average employee who started with us said that they spent the majority of their month feeling unwell. Over 20 days a month, they felt unwell.
Wow.
At 6 months, they felt 2 out of the 30 days unwell. 2.
That's crazy. That's crazy, right?
Well, think about it. How many employees do you have?
I just fired a bunch. Let's call it 12, 15.
12, 15?
Yeah.
Yeah, I mean, imagine your employees went from feeling crappy 22 days out of the month to 2 days out of the month.
Right.
How much would you pay for that?
Oh,
right? To have all your people working at their top.
Well, look, that's the thing. I mean, people, they just call you now. I can't work today. Why not? I'm depressed. I'm depressed most of my life, but I have to get up and go to work. But why can't you work today? I'm fine on my foot. It's everything in the world. I can't concentrate. I think I'm going to watch this later.
These people are thriving, right? So with a bit of support, when we take that isolation away, when they're no longer alone in their homes, when they're getting good food, when they're eating, everything that you put in your free PDF, right? When you put everything that you're eating, they should be eating. When you put the right inputs, what happens 6 months later? Right? They're a different person. I mean, this is not news to you. And I know we see this every day.
Yeah.
But for the person who's out there who feels lousy 25 days out of 30, well, we can help
you. Yeah. So tell everybody where they can find you.
Yeah, Toward.health. You see it down here. Toward.health is our company name. We have a free app, podcast, Low Carb MD podcast. So you go to the App Store, you type Toward Health, and take us to your company. We just published this paper. It'll be in Frontiers Psychiatry. It's the Toward program, and it's the impact on food addiction and binge eating. Go read it. We want you to take that to your HR department. We're saving them money, and you're getting healthy. A lot of times, if you bring it to your HR department, you're going to get it for free, the program, and your company will pay for it. And the reason why they pay for it is simple, Vinny. We get people off drugs.
Yeah. Look, I was talking at a conference, I don't know, it was a while back, maybe 2017, 2018, and I was a keynote speaker. And, Troy, you've seen me, I'll say I'm a wind-up doll, right? I'll say, which talk do you want? Do you want the cancer talk? Do you want the rah-rah? Which one do you need? So these people hired me, and I was in San Francisco, and it's like, yeah, you're first up tomorrow morning, you're a keynote speaker. And I'm like, who am I talking to? And they said, it's a group of medium-sized to large-sized companies who they self-insure.
Yeah.
Come at me again? They self-insure. So they pay, they only have big insurance companies as a supplement on the back end in case someone gets cancer or this or that, the whole thing. But they self-insure everyone else. And I said, well, why do they want to hear from me? And they said, simple. If they could keep their people healthy, they pay less out of pocket. They want to keep these people healthy. So they want to hear from you about how the low-carb diet can actually help them keep their people at work, number one, and number two, keep money in their pocket. And this sounds like exactly what you're doing.
100%. Let me tell you something that you would find. I thought that this is all about the money.
Right.
I thought, like, all these bean counters up there, all they want to see is money. So I was like, let's show them money. The first two studies we published were about money, right? How much money can we save them by getting people healthy? And these patients, they want to come off the drug. Nobody wants to be on drugs. Nobody wants to inject insulin every day. Nobody wants to pop 20 pills at night, right? Nobody wants that. And if they can get healthy without it, they want a safe way off it. So when we showed them, you save $4,000 per patient per year, I thought that they were going to be like, attaboy, Tro, good job, right? You know what they said? They said to me, they pulled me aside and said, Tro, like, you talk to us like you think it's just about money. And they said, I join, we don't care about the $4,000 per patient per year. I'm like, what do you mean? I was like, my parents were immigrants. Like, they counted every little thing, like, what do you mean you don't care about $4,000 per, he's like, the CEOs, they come and they say, you don't know how valuable our workforce is when they're working at their best.
Right.
You don't know when one person in one department gets healthy, how that spreads in that department. And we saw it happen. Now we have over, 200 people in that company who have lost on average about 50 pounds each.
Wow.
Just think about that.
That's great.
Think about, the spouses that have been affected, the other people, they used to hand out, like, you're from Louisiana, man, so all the king cakes and, turtles and the pecans, right?
They still do it. Yeah.
Yep. But now they found a bakery there that, if they really are going to order a cake or something, it's an almond flour cake that's made in Metairie over there. I mean, like, nobody's fooling themselves that it's healthy, but the whole company's changed. They have Dr. Tro approved meals.
Nice.
I worked with their kitchen. They have Dr. Tro approved meals, that are double in protein, and the company subsidizes it. I mean, this entire company is losing weight. They've probably lost, I want to say, like just with us alone, right? You say 200 people, 50 pounds a pop. You might as well triple that in the company. I mean, I was talking to HHS, and they're talking about how to make the country healthy. I'm like, you're going to do it at one company at a time. You're going to do it one school at a time. This is the way. It's going to be one church at a time, one temple at a time. We got to change. You've been at this for 2 decades. I'm still fighting, and we can use the listeners' help if they're out there and they're listening to this, and like this stuff resonates to you. Call our office.
Yeah.
Call our office. We'll help.
And when you think about it, 200 times 50 pounds, that's like 10,000 pounds on average. And that's just one small company. Think about that number. That's a big number, right?
Well, we are, Vinnie, here, get this. We are in our clinic, okay? In our clinic, we're at over 200,000 pounds lost.
That's crazy, right? That's crazy. Folks, go check out Towards Health, TOWARD, no S on there, Health, and go see what Tro has going on. Yeah. And go see what's doing over there. I send people to my consults if they have a medical issue. I'm always telling them to go there. The problem is I tell so many people to do that they can't even get in anymore. But go check it out. Go see what's going on with Tro. They're helping people left, right, and center. You know what to do. I'm going to be opening up the VIP again soon. So if you want to be on that list, go to VinnieTortorich.com/VIP. When we open it up, you'll get the free workouts that I've been working on for a long time. There's 3 workout programs. There's a 6-day weightlifting routine, a 4-day weightlifting routine, and a 2-day weightlifting routine. You would have to pay for whatever I'm going to charge, but if you're in the VIP group, you get it all for free. And we do check-ins twice a month. And I go on, I talk to people, and it goes on and on and on. VinnieTortorich.com/VIP. Rate and review this podcast. Before you go to Amazon, go to VinnieTortorich.com, click through the banner. It puts coal on the fire, gets our train down the track. Tro Kalayjian is at Toward, TOWARD, Health. Spelled just like health, HEALTH. Go check him out. Go do that right now. I know what you're all thinking. Is he just going to stick with that Lita Ford song with Ozzy? Or is he going to play more Ozzy here at the end? Well, you would be right if you said more Ozzy at the end. So on behalf of Dr. Tro, stay on because we have to wait for this to upload. On behalf of Tro Kalayjian, my name is Vinnie Tortorich. Put life into living, and let's do it with a little more of Mr. Ozzy Osbourne.